Hi, everyone. Thank you for joining us today for Best Practices in Education for Cancer Survivors. My name is Shara Morales. And I'm the Project Manager for Healthcare Professional Education at the George Washington Cancer Institute. Before we get started, I would like to take a few minutes to go over housekeeping remarks. We ask that everyone keep their phones on mute to avoid any background noise and disruption during the program. Also, today's program is being recorded. We will use the question and answer feature for this webinar. You will see the question and answer box at the bottom right hand of your screen. If at any time during the presentation you have a question, please type it in and we will address it during the question and answer portion at the end of the webinar. The questions are anonymous and I will repeat the question. We will take questions at the end of the presentation, but feel free to write the questions in the Q&A box as we go and we will make sure to answer them during the time allotted. We will also use the chat box feature, which is on the top right side of your screen. You can use this chat box to interact with each other and introduce yourselves. Because we will be talking during the presentation, we probably won't be able to keep up with the chat. So if you want to ask a question, just make sure to write it in the Q&A box on the bottom right hand of your screen. And as a note, before we get started, we will send out a PDF of the slides and a link to the archived webinar to all the webinar participants. The recording will also be archived and on our website along with our previous webinars. I would like to take a moment to review today's agenda. I will provide a brief overview of the Center for the Advancement of Cancer Survivorship, Navigation, and Policy. Then we will move into the presentation. And then we will wrap up the webinar with the participant Q&A. And one more reminder, we will take the Q&A through the Q&A feature on your screen on the bottom right-hand side. I wanted to provide a brief overview of the Center for the Advancement of Cancer Survivorship, Navigation, and Policy, which brings you today's webinar. The Center for the Advancement of Cancer Survivorship, Navigation, and Policy, which we affectionately call CA-SNAP, was created in 2009 through a generous grant from the Pfizer Global Health Partnerships Program. The mission of the center is to advance cancer survivorship and patient navigation efforts locally and nationally through education and training, policy analysis, outreach, and research. The center offers survivorship and navigation resources that are available online at our website and through a monthly e-newsletter. Additional material is sent through our CA-SNAP listserv to over 2,200 subscribers. We write white papers, create case studies, and work cooperatively with other healthcare organizations to advance patient-centered care. We also share summaries of meetings and roundtables we have hosted to catalyze patient navigation, cancer survivorship, and patient-centered care initiatives. Through CA-SNAP, we have offered several trainings. We were recently awarded funding from the Centers for Disease Control and Prevention that will help us translate our existing in-person trainings to an online format to make them available at no charge to participants. We will start with our executive training on navigation and survivorship, which is the nuts and bolts training for building and sustaining navigation and survivorship programs. We will also be developing a competency-based patient navigator training that will be available through the online academy. Today's webinar is part of the CA-SNAP monthly webinar series that launched in April 2013. We will feature a variety of topics related to navigation and survivorship based on feedback from healthcare professionals across the country. We also have several research initiatives that we provide updates on through CA-SNAP. You can find the archived webinars on these results on our website, along with the reports that accompany them. Our goal is to share the findings so that we can provide you with the information to help you provide patient-centered care. If there are any topics that you would like to know more about, please let us know. Our email is listed on the screen at casnp@gwu.edu. Here's some more information about CA-SNAP resources. You can visit our website to see webinars and reports. We also encourage you to check out our free cancer survivorship e-learning series for primary care providers at the link on the screen. That's cancersurvivorshipcentereducation.org. We have had a lot of oncology professionals complete it and find it useful. We recently launched new models on health promotion and care coordination. Our next webinar will take place on June 18th from noon to 1 Eastern Time, and it will cover patient navigation. Following this webinar, you will receive an email with a recording evaluation survey to provide feedback on today's webinar and today's slides. Today I will be introducing Carole O'Toole and O'Toole from the Smith Center for Healing and Arts Institute for Integrative Oncology and Navigation. The learning objectives, as you can see on the screen, are as follows. Hi, Laura. Hi, Carole. Are you there?
We're here. We are, and thanks for the great introduction. This is Carole O'Toole, and I want to extend my personal thanks to GW and CA-SNAP, I love that acronym, for inviting us to be today's presenters. We're very excited to discuss with you the topic of integrative oncology and integrative navigation, two subjects that both Laura and I feel very passionate about. Before we begin, I do want to make one note. We are presenting here from a very busy downtown area in Washington, D.C., and unfortunately, because we're speaking, we won't be able to mute our phones. However, we may be interrupted from time to time because we sit across the street from a fire station and a police rescue squad. So hopefully all will be quiet in the next hour, but I apologize in advance. So, to get started, I'd like to introduce you to Smith Center and the Institute of Oncology, Integrative Oncology Navigation.
And Shara, we need control of the slides, or we need you to
we're not able to advance.
Okay.
Give us 1 second.
So you don't see the gray arrows on the bottom left side of the screen?
We do, but we're not able to advance it.
Oh, okay. If you can just tell us next slide, then we can advance it for you.
Hold on a second. We'll try it again here. There we go. All right, we've got it. Sorry about that. So, established in 1996, Smith Center for Healing in the Arts is Washington, D.C.'s only standalone organization that offers psychosocial support and creative resources to adults with cancer. Our programs include week-long residential retreats for patients and their caregivers, weekend retreats, classes and workshops in health supportive therapies such as yoga, stress reduction techniques, and nourishment for people living with cancer. We also have a healing arts gallery in our program space and offer many programs and community events on the nature of healing. Since 2007, Smith Center has offered individual navigation services and programs in patient navigation based on our integrative model of navigation that we will discuss shortly.
Next slide.
Yeah, next slide. It's not working again. Sorry. Thank you. Last year, we formally launched our Institute for Integrative Oncology Navigation that's dedicated to ensuring that all people facing cancer and their caregivers are assisted by trained navigators who provide skilled whole-person support along the entire cancer continuum and facilitate access to appropriate evidence-based integrative cancer care resources in conjunction with their medical care. Our work is focused on educating navigators in the provision of quality integrative patient navigation, establishing our model as the standard of care offered by oncology navigators nationwide, and raising general awareness of and appreciation for integrative navigation among healthcare professionals, patients, and the general public. To meet our goals, our ION initiatives are to offer trainings, workshops, and seminars on various aspects of integrative navigation and integrative oncology, participating in national dialogues on the future of oncology care, developing and advocating for national oncology navigation policy, and providing individual integrative navigation services. And today, we hope to raise your awareness of and appreciation for what integrative oncology and integrative navigation is. So my colleague, Laura O'Toole, will begin by walking us through the landscape of integrative oncology.
Hello, everyone. Please let me know if you have trouble hearing me. Thanks again to CA-SNAP for hosting this program and inviting us to present. I'd like to give you a brief introduction to what integrative oncology is so that you can understand the framework that undergirds integrative oncology navigation. So what is integrative oncology not? It is not a piecemeal use of CAM with conventional therapies. To integrate is to form, coordinate, or blend into a functioning or unified whole. Integrative oncology, therefore, is an evidence-based specialty that thoughtfully coordinates and blends complementary therapies with medical treatments. The goal is not more is better. Rather, the concerted effort is to enhance the efficacy of medical treatments and relieve the patient's distress and suffering. There's evidence that integrative oncology care has value across the cancer continuum. Through a strong relationship, patients and their doctors and other care providers share in decision-making. All the stakeholders understand and trust in the individual's innate healing capacity. Quality of life is a key value guiding the care. There are a number of factors bringing integrative oncology to the forefront. We're all aware that cancer is on the rise, as are the costs of cancer treatments. Not only can about 50% of all cancers be prevented by people changing their lifestyles, we're now seeing evidence that lifestyle and nutritional interventions can prevent cancer recurrence. More and more people can expect to be long-term cancer survivors. These survivors are hoping for quality of life in their survivorship years. Until we become more integrative in our approach to cancer care, patients will continue to be closeted CAM users. The good news is that we're seeing a body of evidence emerge to support integrated CAM with conventional cancer treatment. The Society for Integrative Oncology, which is called SIO for short, and NCI's Office of Cancer Complementary and Alternative Medicine are just two of the organizations ensuring the quality of research related to CAM and integrative cancer care. Dr. Jeffrey White, who's director of NCI's Office of Complementary, of OPCAM as they call it, OCCAM, recently authored a chapter in Abeloff's Clinical Oncology textbook. He summarized the interventions used to improve quality of life, prevent or manage cancer symptoms or adverse effects of treatments, as well as improve survival or the response to standard medical treatment. The following 5 slides list some of the evidence highlighted in his chapter. We find that lifestyle modification through diet, physical activity, and mind-body skill development in conjunction with cancer treatment improves outcomes in breast, colorectal, and prostate cancers. Acupuncture, imagery, and Reiki seem to be effective in pain management. Patients with arthralgias induced by aromatase inhibitors are benefiting from acupuncture and vitamin D supplementation. Here you see that cachexia and fatigue are eased by complementary approaches. A recent study reported in the Journal of Clinical Oncology added more evidence that drugs such as the psychostimulant Provigil do not improve cancer-related fatigue in patients with lung cancer. The researchers went on to suggest that there are safe and reasonable options for fatigue relief, such as physical activity, psychosocial, and mind-body interventions. ASCO concurs, and they recommend these approaches in their guidelines of fatigue in cancer survivors. CAM interventions are useful for abating nausea and vomiting, neuropathy, and hot flashes. Dr. White points out that there's evidence to warrant integrated CAM therapies to ease mucositis caused by chemo. And finally, patients find that the stress of living with cancer is relieved with meditation, relaxation, music, and imagery therapies. By the way, Smith Center sponsors a cancer news that you can use listserv called Media Watch. I scout the news related to cancer, and if it's currently and practically useful, I email links of these articles to those on the listserv. If you're interested in receiving these links, please email me to sign up to be on the listserv, and my email is listed later in this presentation. Well, compliments of Dr. Matt Mumber, an integrative radiation oncologist at the Harbin Clinic in Georgia, I'd like to tell you about the conventional interventions used for treating a 46-year-old mother of 2 grade school-aged boys. This patient had stage 4 triple-negative breast cancer with a single bone miss. She had the usual workup. She was offered the best in conventional treatment, IV chemo, mastectomy, radiation to her bone mets, and ongoing IV Zometa. She took high-dose antioxidants and herbs during chemo and radiation therapy, and not surprisingly, didn't tell her doctors about this. She missed lots of appointments because social and family concerns got in the way. She didn't complete all her treatment. She stuck with her sad, standard American diet. She became fatigued and slept more often. She developed lymphedema in her arm. She didn't come back for follow-up, but went instead to a faith healer who prescribed homemade herbal supplements. Stay tuned for a rewrite of this story after we tell you about Integrative Oncology Navigation.
So after hearing Laura's review of evidence supporting the use of CAM in cancer care, how do we translate that? How do we offer integrative oncology through navigation services? Or in other words, what is integrative navigation? Patient navigation in oncology care was born from the frustration and the foresight of Dr. Harold Freeman, working with the medically underserved in Harlem, who were consistently presenting with advanced cancers or falling through the cracks when receiving care. He conceived the idea of a trained individual acting as a guide to patients in accessing care in a timely fashion and ensuring that they receive diagnostic services and treatment. His development of patient navigation in the early 90s led to research proving its value in improving breast cancer screening rates as early as 1995 and improving 5-year survival rates by 31% about 10 years ago. And over the years since then, there have been national research programs on patient navigation, as well as multiple studies demonstrating the value of navigation in offering support, assistance with information needs, problem solving, and coordination of care. Dr. Freeman's work in the development of navigation has been invaluable to patients in removing some of the barriers to cancer care, such as financial barriers for the uninsured and underinsured, communication issues, medical system barriers, and transportation or child care that can negatively impact the patient's ability to seek and obtain medical care or complete treatment. However, despite the positive impact navigation has had in moving patients successfully through our medical system, we continue to hear the plight of cancer patients, such as Jessie Grumman, a cancer survivor and president and founder of the Center for Advancing Health. Jessie writes that each of the 4 times I received a cancer diagnosis, I felt like I had been drop-kicked into a foreign country. I didn't know the language, I didn't understand the culture, I didn't have a map, and I desperately wanted to find my way home. The delivery of cancer care remains highly fragmented as experienced by almost every cancer patient and acknowledged by such esteemed organizations as the Institute of Medicine. The situation results in high levels of distress for patients and their caregivers due to unmet information needs and often inadequate support and miscommunication. The experience of cancer and navigating our complex medical system all too often takes a severe toll on the individual's physical energy, their emotions, and their spirit. We talk about patient-centered care, but too often we hear from our patients how dehumanizing the cancer experience is. At Smith Center, we have long shared the philosophy that every individual has the innate ability to heal, even in the face of a life-threatening illness. We believe that cancer impacts every aspect of a person's life, body, mind, and spirit, and that whole person or patient-centered care needs to take that into account. While navigation has grown over time to include assistance during recovery and survivorship, and several models now include aspects of psychosocial support, we saw the potential for navigation to move beyond what our medical system currently offers and assist patients in their healing on all levels, not only the physical but emotional and spiritual healing that takes place as well. So our definition of integrative navigation is simple but comprehensive. Integrative navigation provides individualized assistance to patients and their caregivers to support them on all levels, physical, emotional, and spiritual, across the entire cancer continuum. We strongly believe that every cancer patient deserves access to what we call the best of both worlds, what is available from both conventional medical treatment and from appropriate complementary supportive resources. We view integrative navigators as critical players in the healing of individuals by supporting them to engage more deeply in their care and guiding them to appropriate proven resources in the complementary arena, such as nourishment, stress reduction techniques, and body or energy work that can contribute to whole person healing. This graphic represents our model of integrative navigation, illustrating the solid foundation of knowledge, skills, tools, complementary therapies, and support provided by navigators that can help move a patient from fear and a sense of helplessness and hopelessness to a place of strength and engagement that improves the quality of the cancer experience overall. Our model uses a patient-honored approach where we help adapt the system as much as possible to the individual's needs so that they can be better met and healing is fully supported. Since 2007, we've applied this model in serving our city of Washington's underserved African American and African immigrant residents in both hospital and community settings. This was done through continuous grant funding that included rigorous independent evaluations of our integrative navigation programs from the Howard University Center for Urban Progress, or CUP as it's known. Our hospital integrative navigation program was first instituted at Howard University Cancer Center, where our population was presenting with advanced cancers at 5 times the national average. In our first year alone, we contributed to a 15% improvement in treatment compliance rates, and we ran the program for 5 years with continuous grant support until the hospital took over fiscal and operational management of the program as a permanent hospital service. The CUP evaluation reported that 73% of patients surveyed had used the navigation services, with 86% rating the integrative navigator as very effective in supporting them through their diagnosis and treatment. The program was highly regarded by clinical staff, although findings also showed that the overall hospital climate can impact the use of integrative resources and that patients were more likely to use complementary therapies post-treatment. We then extended our model out into the community, partnering with several African American churches and employing a number of cancer survivors as community navigators, some of whom are pictured here. Our community navigation program reached over 12,000 underserved residents, offering outreach and raising awareness of navigation, providing individual support, educational workshops and classes, and serving as liaisons to hospital navigators and facilitators to clinical and supportive services. The CUP evaluation of the Community Navigation Program included extensive surveys of our navigators and their patients, community partners, and evaluations of educational events and programs. Our navigators reported strong support for their work from the community at large, as well as their individual patients, and church leaders considered navigation services as important as any of their existing programs. Patients praised the assistance they received from the navigators, and the educational programs demonstrated positive changes in health behaviors and had a positive impact on raising awareness of wellness and integrative navigation. The next 2 slides summarize what integrative navigators provide. You may notice that there's close alignment with some of the services offered by more traditionally trained navigators, but you will also notice we are enhancing and expanding the role that patient navigators play by educating patients on the role and value of supportive complementary therapies, taking the lead in facilitating access to CAM resources, introducing evidence-based CAM therapies to patients, such as offering general nutritional guidance or information, perhaps demonstrating simple yoga poses, or instructing patients in stress reduction techniques. And navigators also guide patients on responsibly using evidence-based complementary therapies in concert with their medical treatment. Through emphasis on deep, culturally sensitive listening and communication skills, integrative navigators are trained to work in partnership with each patient to identify what that individual feels stands in the way of their healing and to equip each patient with the tools, skills, and knowledge from the complementary arena to facilitate healing and a better quality of life at every stage of the cancer experience. To illustrate this, I'd like to look at what is often a difficult topic for healthcare professionals to address with patients, and that is the spiritual needs of cancer patients. Integrative navigators, for example, are trained to screen for spiritual distress, initiate a conversation with their patients, and depending on their interaction with their patients, perhaps suggest resources and offer to connect them to more specialized spiritual care professionals. Their boundaries are clear. Integrative navigators do not provide professional spiritual counseling, but in an often neglected area of patient care, they can step in to support their patients in acknowledging their spiritual needs and connect them to resources that can nourish their spirit. I think this may be more clearly illustrated by the following chart that walks us through the primary roles that integrative navigators can play at each stage of the cancer continuum, highlighting some of the most common needs of the patient at that stage. The primary assistance integrative navigators can offer to the patient at that time, and also what CAM therapies may be most helpful to the patient to address those needs. For instance, during treatment, patients are most likely to be consumed with settling on a protocol with their oncologist and their medical team, mentally and physically preparing for the procedures, juggling treatments with their personal lives and dealing with side effects, perhaps from their treatments or perhaps from their cancer or both, and staying focused on completing treatments while keeping their anxieties at bay. So what are the primary roles of an integrative navigator during this phase? Well, in addition to helping patients stay organized and on track with their treatment plan, integrative navigators expand the model by serving as coaches, teachers, researchers, and guides. This is an opportune time for navigators to work with their patients on developing personal integrative treatment plans that include complementary therapies, such as what Laura reviewed earlier. More and more patients are wanting to become more actively involved in their care and need guidance in identifying what is appropriate, what is safe, and what is useful in addressing their individual needs. Integrative navigators are trained to guide patients to reputable information sources on CAM, to assist them in finding and assessing CAM resources and professional complementary practitioners, and to communicate with their medical team in implementing their integrative care plan. In practicing whole person care, the integrative navigator is well equipped to offer a variety of stress reduction techniques and creative resources that support the patient emotionally and spiritually during this time. These may include guided imagery and visualization, breath work, progressive muscle relaxation, and other mind-body skills that assist in coping with treatments and reducing anxiety, and perhaps offering expressive techniques such as journaling, painting, poetry, or creating meaningful rituals around healing to nourish the patient as they go through treatment. Notice how closely integrative navigation is aligned with the description of integrative oncology principles that Laura mentioned earlier, including engaging the individual patient, making use of CAM therapies in concert with medical treatment, alleviating patient distress, and working to improve the quality of life at every stage along the cancer journey. There are many forces shaping cancer navigation currently at work. Among the most prominent are obviously the Affordable Care Act and, of course, the ACOS accreditation standards that require patient navigation services be in place by next year. Greater attention is also being given to navigation because of the growing cancer workforce shortage. A recent report by ASCO has predicted that in 10 years, the demand for oncology services will increase by 42%, while the supply of oncologists will only grow by 28%. As the need for navigation is increasingly recognized, so is integrative navigation, driven by the demand for CAM by cancer patients, the growing support for integrative cancer care among healthcare professionals, including navigators, and research documenting the value of integrative care. So let's take a closer look at each of these 3 points. First, the profile of survivors. The 13.7 million cancer survivors alive today in the U.S. have become a very impressive force and agent for change. And the ASCO report published a few months ago predicts that in the next 15 years, the number of new survivors will increase by 45%. Historically, cancer survivors have been shown to be active users of CAM, often segregating their complementary treatments from their medical team. Research estimates vary, but it's generally assumed that about 65% of cancer patients use some form of complementary modalities versus 53% of non-cancer patient CAM use. And anywhere from 25 to 50% of cancer patients report that they discuss their CAM use with their doctors, depending on the type of CAM being used and the type of cancer they are dealing with. As the numbers of survivors have increased, so has the change in attitude of survivors, adopting a consumer approach that demands better care, communication with their providers, and more involvement in their decision-making. Survivors are also increasingly aware of the relationship between wellness and cancer prevention, treatment, and recovery, and the role that CAM can play in that relationship. They track medical and technological advances more closely, and they have greater access to information and resources, including navigation, and, given their use of CAM, are turning more towards integrative navigation. This change in the profile of cancer survivors over the years has naturally had an impact on cancer care professionals. The Society for Integrative Oncology, which has been holding annual conferences on the topic of advancing evidence-based integrative health care to cancer patients for over 10 years, just last year invited navigators to the conference, where they were formally recognized and asked to serve as advisors to the SIO. Oncology nursing has also recognized the consistently increasing use of CAM by survivors and the need for patient guidance and coordination of CAM use with their medical care, as noted in the professional journal Seminars in Oncology Nursing, that recently stated the need for all navigators to be well-versed in helping patients to access integrative cancer care therapies. And just last week, I was fortunate enough to be invited to attend a national symposium that was hosted by Livestrong that drew about 100 leaders in cancer care who had gathered to discuss shaping a new medical school curriculum dedicated to patient-centered cancer care at the University of Texas. And I'm happy to report that integrative cancer care and integrative navigation was a key component in the discussions. And it was at a 2012 SIO conference where it was announced that a study of an integrative approach to cancer care can lead to significant cost savings for hospitals. The study was conducted by the Urban Zen Foundation in New York City, an organization whose mission is to change the current healthcare paradigm to include integrative medicine and promote patient advocacy. The study, conducted at Beth Israel Medical Center in New York City, showed medication cost savings of over $204,000 by the second year of the program, which included the startup costs, and cost savings that would continue to increase annually. The authors calculated total savings from decreased medication use to be over $977,000 annually, an estimated savings of approximately $156 per patient per day. The integrative approach at Beth Israel included offering a more healing environment in the inpatient setting, yoga, holistic nursing, and navigation services. While there's a strong call for continued research in this area, patients and navigators are already noting the benefits they've encountered from integrative navigation. Anecdotal evidence from navigator observations and direct patient reports credit integrative navigation with improvements in symptoms and concerns after referrals to complementary modalities, a reduction in stress, increased quality of life, and increased sense of control in being treated as a whole person, with improved patient satisfaction, feeling they were listened to as an individual. There's increased knowledge of what patients can do to improve their lives with less focus on their limitations and more confidence in their healing, knowing they have options. They are better able to make informed choices, communicate their fears, and move forward in getting the care they need. There is an increased use of nutrition, exercise, and supportive therapies, along with improved access to complementary modalities that patients report they would not have sought from their medical team. They noted improved self-care and involvement in treatment, affecting treatment compliance with better outcomes overall, and the navigators themselves reported improvement of self-care practices amongst themselves. And finally, patients report having a more positive outlook. They feel better equipped emotionally to travel the cancer journey and feel more hopeful, happier, and able to connect with their loved ones, which we believe is a true definition of patient-centered care. So after hearing about all the value and practice of integrative cancer care, we hope you're wondering about how one becomes trained in integrative navigation. So Laura is now going to walk us through the current trainings and our training program.
As demand for patient navigation has increased, so has the demand for training. Over the years, more and more organizations have started offering more traditional patient navigation training, beginning with the Freeman Institute and the Colorado PNT, along with newer organizations such as Educare and AONN. And now, many universities and online programs offer training in navigation. In developing our integrative navigation model and program, it became clear to us that we needed to create a training program in integrative oncology navigation. We knew that the training model had to embrace whole person care across their cancer experience. We consider Smith Center's success in catalyzing significant lasting changes in participants attending our residential retreats. That led us to use an intensive blend of didactic and experiential training to expose students to integrative modalities and let them appreciate the effects of self-care practices in changing their own health and well-being. We agreed that our graduates would benefit from ongoing post-training education and support as they began to translate their knowledge into practice. After our first year of training, our own navigators, we began to get requests from navigators in different parts of the country to offer a national training. This map shows where some of our trainees are from. Since 2009, we've offered the training nationally, as we recognize that we were the only organization offering professional training in integrative oncology navigation, and to the best of our knowledge, we remain unique in this regard. Because many different types of navigators can benefit from learning about integrative cancer care, this training model is appropriate for navigators from diverse disciplines and backgrounds. We've attracted navigators across the country who serve diverse populations in very diverse settings. For instance, Hopi Indians, they serve Alaskan Natives, urban hospital patients, and refugees served by centers outside of Boston. Here are some of the main topics we see as essential to include in the curriculum. A quality-based training goes beyond imparting knowledge. It has to help participants build skills and have tools to become integrative oncology navigators. NBCC, continuing ed credits, as well as nursing contact hours, add value for nurse, social worker, and therapist navigators. We also think it's a great benefit if navigators can preach what they practice in terms of self-care. ACOS-accredited hospitals need to derive benefits by their navigators returning from the training and making program changes that would meet COC patient-centered standards. Howard University's Center for Urban Progress conducted independent evaluations of our trainings in 2009, 2010, and 2011. Trainees were very satisfied with the quality and content of the training. They said it had a positive impact on their work. They were more effective as navigators, and they began including complementary modalities in their practices. In 2013, we surveyed our alumni from the previous 5 years. Most surveys said they continued to apply what they learned. They saw their patients benefiting from practice changes the navigators made as a result of their training. Finally, the training had a positive influence on their own self-care. We recognize that these evaluations and surveys are limited in their generalizability. That's why the Institute for Integrative Oncology Navigation is part of the national dialogue led by groups such as the National Patient Navigation Consortium. We see the need to contribute to developing standards, models, and curriculum for oncology nursing education, oncology navigation education, training, and certification. We urge you to also contribute to shaping oncology navigation into a service that's centered on the whole patient and seamlessly integrates therapies, conventional and CAM, for the good of our patients. Speaking of the good of our patients, let's see how integrative oncology navigation might have changed the course of our patients' treatment and life. Remember our 46-year-old mother of 2 boys, under strictly conventional medical care and without the help of a navigator, didn't complete her treatment. During treatment, she used supplements and herbs without telling her care team. She was even lost to conventional medical follow-up and began using a faith healer. She continued to eat an unhealthy, sad diet. Let's start all over and say she had an integrative oncology navigator from the get-go and throughout her cancer experience. That navigator screened her for the many distresses that were affecting her life. The navigator connected her to resources to help her pay for her cancer therapy. She made counseling referrals for the patient's distressed sons. The navigator linked the patient into healthy eating classes and taught her mind-body techniques to improve her coping skills. Supportive therapies such as massage, acupressure, and ginger helped her reduce treatment side effects. The navigator taught the patient that it wasn't a good idea to take antioxidants during chemo and radiation. The patient used physical activity to address her fatigue and had manual decongestive therapy to prevent lymphedema. She made it through all her therapy. In her long-term survivorship, her navigator was there to connect her to a survivorship group as well as pave the way for her to attend a residential retreat. The patient was advised on appropriate supplements to take. She shifted to a plant-based diet. She became a poster child for the benefits of integrative oncology navigation and now volunteers as a peer navigator. Dr. Rachel Remen captures the essence of the value of an integrative approach to caring for those facing cancer. When we are doing healing work, we honor something innate in the person, something which is sometimes deeply buried. The healing work is to bring that out into the light, into the day, and allow it to do its work. Thank you all for your time and your attention. Be sure to, if you want more information about integrative navigation or our next training, visit our website. Our next training is being offered in September. And Ann and Shara, we're going to turn this back over to you.
Thank you, Cheryl. Thank you, Carol. Thank you, Laura. We appreciate that. Now we have a few minutes for questions and answers. As a reminder, you can use the Q&A box on the lower right side of your screen to submit a question. And while we're waiting for a few to come in, I wanted to mention again that we will be sending out the archived recording of this webinar along with the slides and a brief evaluation after this meeting. Okay, so it looks like we have a question. It says, if my organization doesn't have many integrated services for the navigator's perspective, what are some other recommendations that you might have? Carol?
Yeah, we're just, we're asking the questioner if she's talking about or he's talking about not many resources at the facility itself or in the community. Because at our training.
Yeah, it does sound like it's at the facility.
Okay, well that's often the case, and we certainly recommend and emphasize at our training that a large part of the Integrative Navigators' work and responsibility is to become very familiar with what is appropriate and acceptable in the immediate community, and gaining access, getting to know those practitioners, getting to know the state's licensing requirements and certification for complementary practitioners, and really becoming the knowledgeable resource for their patients on what's available to them in their own backyard. Outside of that, if the area itself is really devoid of many complementary resources, we lead them to very reputable websites where you can often link into complementary therapies online.
Yeah, another thing I want to add to that as well, when we introduced our program at Howard University Cancer Center, that we felt it was really important to bring the clinical staff up to speed on what were some of the integrative evidence-based CAM therapies that might be woven into cancer care. So we conducted a series of workshops, usually held during grand rounds, and invited not just the medical staff, the nursing staff, and any other staff at the hospital to come and learn about what are the evidence-based integrative therapies that might be available to patients, and then also pointing out to them where they might access those therapies.
And we reinforce that by offering classes, preparatory classes for conventional medical treatment to the patients at the hospital, where over a meal and healthy food, we brought in the clinical staff who gave brief presentations on preparing for various procedures, whether it was chemotherapy, having a surgeon come in and talk about surgery, et cetera. And then while the staff were there, we introduced some of the CAM resources in the community and did some demonstrations of different mind-body skills to cope with their anxiety and help them prepare for their treatments, so that the clinicians saw firsthand how patients were accepting that, what their questions were, et cetera.
Yeah, and one more thing I'll add, I think this is one more thing. The other thing we realized from our work at Howard University Cancer Center is that, we were able to serve people who came through the door, but what about all the patients out in the community who never were making it into the door of the hospital, which is why we started our community navigation program to connect people to the hospital. So I would suggest that people who work in the hospital reach out a hand into the community, not only to find what resources there are, but to really link together in partnership with maybe community navigators and integrative therapy practitioners, so that you have a real community-based handshake between the hospital and the community.
Okay, wonderful. Thank you so much. Friendly reminder that if you have any additional questions, go ahead and use the chat box on the bottom right-hand corner. We do have another question. Do you have any advice on how to really engage physicians in some of these integrative practices?
Well, one of the things, and this question may have come before our previous answer, but one of the ways we did it at Howard was to have these medical grand round presentations. And so that was a good way to educate them. And we found, at least at Howard, they became very interested and supportive, and not only interested and supportive, but they actually began to make referrals to the navigator. So that would be one way you could approach it. And Carole, I'm wondering if you have other suggestions.
Well, a couple of things. Also, we all talk about burnout in our profession here and dealing in the cancer world, and so often it was very appealing to offer the clinical staff some instruction on self-care practices, and seeing the effect it had on them, in some cases really opened people up to more discussions. More and more we're seeing integrative practitioners, integrative physicians. We're starting to see them here in Washington, which is really hopeful and helpful, as well as, what was I going to say? I've lost my train of thought for the moment. But,
well, and I also would add, really consider the Society for Integrative Oncology as your friend and as a resource. I'd really encourage you to join it. They actually have different levels of membership if you're a patient advocate, for instance, versus physician. And their website is a wealth of information even if you aren't a member, but I'd really encourage you to join. You can get lots of information just from their website, attending the conferences. At Smith Center, after our navigation trainings, we typically do a WebEx for our alums on the best of SIO and report the information from the conference. So if you could link your physicians directly up with SIO and some of the premier members there, that would be another way to link them to seeing the evidence base for integrative cancer care.
And I remembered my thoughts. I'm going to add it in, and that is to not be afraid to talk it up all the time. It takes a certain amount of courage to, initiate these conversations on integrative cancer care and CAM therapies. But all you need is one champion, and we were fortunate enough to find that in one of the physicians at the Cancer Center who continued to support us visibly with the other clinical staff and consistently, and that helped tremendously. Also linking them to some of the professional journals, sharing with them the research that's out there. Just keep it visible, keep talking about it, and you make progress. A particular professional journal that I want to point out is the Integrative Cancer Therapies Journal.
Okay, thank you so much. We have one last question. It says, are there any additional evaluation efforts underway?
Overall in integrative cancer care?
Yes. Yes, ma'am.
Or integrative navigation? I am not aware of any for navigation per se. We are working on some research here, but it is still a fairly new field. As far as CAM, it's going on all the time. There's a tremendous amount of research.
Yeah, I'm wondering if the questioner is talking about evaluation of our program or evaluation for the evidence base for integrative cancer care in general.
So it seems like it's for integrative navigation.
Okay. Yeah. So, well, we hope that we are inciting some interest here in others wanting to look into that. And SIO, as Carole mentioned a couple of years ago, they had Dr. Freeman speak, and he really made the case for navigation. And of course, SIO being integrative cancer care seemed to bring that forward as a topic of research and evaluation. So I would have to look at the SIO to see where that is sitting on their agenda for research promotion.
Okay, that sounds great. Thank you so much. Okay, so well, thank you all for participating in today's webinar. Here is some additional information about the CA SNAP resources. You can visit our website to see webinars and reports, and we also encourage you to check out our free Cancer Survivorship e-learning series for primary care providers at the link on the screen, and that's cancersurvivorshipcentereducation.org. We have a lot of oncology professionals that are completing it and finding it useful, and we recently really launched new modules on health promotion and care coordination. We want all of you to save the date for our next webinar, which will take place on July 16th from noon to 1 p.m. Eastern Time, and we will provide more information on that webinar through our listserv. So again, following the webinar, you will receive an email with today's recording, evaluation survey to provide feedback on our webinar, and as well as the slides. Thank you again, Laura and Carole. Very much appreciate it.
Thank you so much.